Hello, we are from the NHS Innovation Accelerator, and the topic of our discussion today is patient involvement the silver bullet to spreading innovation across the NHS? So my name is Laura Boyd and I'm the Programme Manager for the NHS Innovation Accelerator, and we are very lucky to be joined today by two of the fellows on the programme, as well as Trevor Fernandez. I'm going to ask everyone to introduce themselves, and then I'll say a few words about what the NIA is.
I'm AHSN and I'm a professor in maternal fetal medicine, so obstetrics at St George's Hospital in London.
I'm Trevor Fernandez. I'm a patient and public representative. I chair the Citizens Senate in the East of England, and I'm also a patient and voice partner for NHS England.
And I'm Alistair Martin. I'm the Chief Commercial Officer at Transforming Systems.
So the NHS Innovation Accelerator is something that's been going for 3 years, and the reason it was set up primarily is because it takes a huge amount of time to get evidence-based innovations, ideas that work, that have been shown to work either in the NHS or elsewhere, to be spread across the NHS for all patients and clinical benefit. It's said that it takes something like 17 years for an innovation to be widely taken up, which from a personal perspective, a mum of two, seems absolutely ridiculous when we think about how do we improve patient outcomes and equalities. So through selecting or through having an annual call for evidence-based innovations led by fantastic individuals who are willing to share their experiences of how they are overcoming some of the challenges to spreading innovation in the NHS, we've been working really hard to try and understand, well, what does make it easier to spread innovations across the NHS? We have 36 fellows who represent 37 innovations ranging from patient safety devices to models of care to IT platforms to support people to manage their care better at home, to innovations that help the workforce be able to deliver their jobs better. But what we've really struggled with over the past few years is what are the key components to spreading innovation. So after our first year in 2015, the Health Foundation kindly commissioned an independent evaluation of the NHS Innovation Accelerator. And this looked at several things. It looked at what impact was the NIA having on the fellows and their innovations, what impact were those innovations having on the NHS, and probably more crucially for the wider system, what were the kind of key factors and contextual things that needed to be in place to help innovation spread more widely. But what really surprised me from this report was the absolute crucial role of the patient in helping to develop innovations, but also to spread them. So we looked at a huge number of factors. You know, what is it? Is it around tariff? Is it around finance? Is it around clinical champions? Is it about the political landscape? And while all of those things are absolutely crucially important, the intrinsic factor throughout every single type of innovation throughout the NHS was patient involvement. So from a personal perspective, I was absolutely delighted because finally we have something in writing showing us evidence that the patient and patient involvement is absolutely crucial. Now, the report highlighted 4 different ways that patients and the public can support with innovation. And we'll have a bit of a kind of discussion about some of those aspects shortly. But they range from maybe the obvious patients and people involved in the design and the development of the innovations. The second is around acting as a kind of inspiration or motivation for keeping innovators inspired and reminding them as to kind of why they are developing their innovation. I'm going to ask Trevor to talk about that shortly later. And the third and fourth ways are really around the role that patients and the general public can have in both laying the groundwork for innovations to be widely adopted and also urging and encouraging their local NHS to adopt those innovations. So I'm going to pause there. I'm going to hand over to the panel to kind of have a chat about what this has meant for them.
Essentially, Waitlist is an app for patients that geolocates you and routes you to. It uses real-time waiting time information for accident, emergency and walk-in centres and minor injury units and routes patients to the quickest place to go in an urgent care emergency for minor conditions. for us, all of our services as a digital startup are built using co-production. So we say patients and users, they're the architects of the products that we design. We literally capture in a series of sort of sprint workshops with with all of those groups together, the look and feel and the amount of non-obvious problems that have been flagged by patient representation on those groups is significant. And actually it just...
Non-obvious meaning that the management didn't think of it, or the...
Exactly, yeah. It's like a real front door user, kind of experience that just runs through everything you end up designing, and it makes it so much slicker. And then it also, when you're looking to spread and grow, creates instant kind of empathy within any new area, because they look at it and go, oh, this looks good, I can see how it works.
So our innovation is called Hampton, or Home Monitoring of Hypertension in Pregnancy, which is actually started as a solution in response to existing needs. So up to 10% of women experience high blood pressure in pregnancy, and these women are advised they come to the hospital 2-3 times weekly, and we monitor them because some of them will develop this condition called preeclampsia. So we developed this online secure platform which has an app as a patient interface, and which enables these women to monitor their blood pressure and urine at home. We made sure that the patients were involved at every single step in the development. We made sure that we have a wide representation of women, so not just women that are from Caucasian ethnic background, or women from the middle or high social class. We wanted to make sure that we have a representation from women from minor ethnic backgrounds, as well as women from low socioeconomic class. We want to make sure
can I just ask you a question about that? How much of a challenge was it to try and get the right cohort of patients? How did you do that?
Well, I think we were lucky, because I work at St George's Hospital in London, which is, as you know, is based in Tooting. Mm-hmm. So about 50% of pregnant women that we look after actually come from non-Caucasian ethnic backgrounds,
right.
And the commonest ethnic background that we have is women from Asian background.
What about patient representation?
Where
did you get that from?
Yes, we approached women that actually come to the hospital, and while we are developing the system, obviously some of them had experience already using the conventional pathway, and some of them were using the Hampton, and therefore we had to target 5 women from each different ethnic background, because we, as I said, we wanted to make sure that the system is...
That's unusual, because you're in a location where that is already made and available. Yeah. But a lot of areas, especially more affluent areas, struggle for that inclusive representation. I know we do.
One of the challenges that's been levelled against kind of asking people what they think they need and want is the example that was drawn from Dyson, and apparently when he was designing his vacuum cleaner, the consumer insight was saying, no way do we want to see our dirt flying around inside a glass or plastic tube, that's disgusting, we want it concealed away from us. But look at Dyson now, it's a world-leading vacuum cleaner. So I just wonder whether people have any thoughts or experiences of that around this table.
It's an interesting point there, Laura. I've come across, over the 9 years that Transforming Systems has been around, we've come across a number of companies that have different approaches to design and development. The co-production and putting patients and users at the heart of what we do was a choice that we made that we wanted to do. There are others, and you could include Apple in this scenario, that actually try and say, well, we know what people want and we will design that. And in the case of Apple, they've done it pretty successfully, actually, haven't they? And Dyson as well. Mm. I think for me, you've got to look at the culture of your environment that you're in. So if you take the culture of the NHS and the culture of the users of the NHS, it's a public jewel. It's one of the key pillars of our society, and people are incredibly passionate about it. Elections are lost on health, aren't they? So for me, we didn't see another way to go with health. We thought, well, actually patients are intrinsic to it. They are ultimately the customers of the NHS, and if you want to make adoption and spread easy, you need to have something that works for people that are using it. So that was the reason for our approach. I don't know if you've got any views on that.
You know, our experience with the feedback that we had, we learned a lot from the feedback. In fact, I would say we learned more from the negative feedback or the suggestions how to improve the app compared to actually just the positive feedback. And we really sort of wanted the women to make suggestions and to be really critical and tell us how to make it really user friendly and very easy to use.
That's a good way to turn the negative into a positive, isn't it? Yeah, absolutely.
And what's interesting to me is that the NHS is in a unique position, I think, where it's really starting to grasp the digital nettle. So it's actually seeing the emergence of these technologies that can actually make pathways better and cheaper and more enjoyable. And, you know, how can patients not be a part of that? I mean, that's just where your core of your advice needs to come from. Where I think we need to be better, I think, is as companies, is recognising that approach really works.
So I'm Corinne Allen and I coordinate FREED, which is First Episode Rapid Early Intervention for Eating Disorders. And FREED is a service model and care package for 16 to 25-year-olds with an eating disorder of up to 3 years duration. So it's about providing rapid access to evidence-based eating disorder treatment, but also tailoring treatment to the specific needs of this particular group. Patient involvement in innovation does take a little bit more time. You can't operate as quickly if you need to factor in time to meet with patients, set up focus groups with patients, think about what patients are going to be needing. But it is an absolutely worthwhile investment. So you need to allow a little bit more time to make it happen, but the returns are completely worth it. You do end up with a better product. And that's at an overall level with your innovation or your service, but also every step of the way with resources that you create, websites, social media content. It is all richly improved by having service users provide input.
Another key advantage of the patient involvement, for me as a clinician or doctors, they tend to do things that, you know, the same way that they've been doing it for the last 50 years. And the nice thing about patient being involved in your innovation is that they have a new look to things. They really have this reflection and critical of why we're doing it this way. Why do I have to come to hospital every couple of days just to have my blood pressure and urine checked to tell me it's okay, come back in 2 days? And therefore it has part of this innovation in a way that questions the way we do things. And therefore it drives you to maybe stop things that you've been doing it for
Change
years,
process.
and if it's not convenient to the patient or there's not really much evidence to back it up, and also try to use the technology that the patients or the public are very familiar with to be able to incorporate it into healthcare and benefit from the advantage that this technology offers.
Yeah, it's systems as well as product.
I think that's a really helpful point, because some of the kind of criticisms of, I guess, co-design and you know, engaging lots of people is that you don't get anything new, you just get incremental improvement. But actually, the example you've given really challenges that, because you're getting a breadth of experience from basically all over the world. Let's face it, we're in London, challenging kind of the status quo. So actually, that kind of blows it out of the water.
I also think, when I think back to when I was in the commissioning or when I was running as an operational service, you think about money a lot, and the thought about money can stop you from embarking on something new. And it's right that you should think about money, but I always used to say to people that you concentrate on the pathway first and then put the money at the end, and then you figure out how you're going to resource. And having patients involved in that discussion makes you do that without you having to consciously do that. So it takes it off the table, because you start focusing on what the pathway needs to look like, because that's what patients are primarily driven by, isn't it?
Yeah, you're spot on there. And what we've noticed and what we try and tell people who work in the NHS is that when you involve patients, involve them in a partnership don't just have them representing for that programme. Because something peculiar happens when they become a partner. They share the responsibility of success and failure, and they actually work with you to make it successful. They overcome the hurdles and the barriers, and you have, you've got more for your money then, because you've actually got somebody who's experienced that condition and that pathway, who now is wanting to overcome the obstacles. Really powerful, and it works really well.
So one of the things we find on the NIA is that it takes a long time, and B, it's personally can be tremendously hard going and requires a huge amount of tenacity on the part of the innovator. And this is where we found that patients can help fellows remain tenacious, but also remind them of that initial passion as to why they started what they were starting.
Okay, I'm Julia Riley. I'm the clinical lead for Coordinate My Care. And Coordinate My Care is a clinical service which creates urgent care digital plans for vulnerable patients. One group of those vulnerable patients are the dying patients, and those plans are then linked to all the urgent care services, so 111, the out of hours GP service, and the ambulance service. So when a patient needs help and they call for help, or their carers call for help, the urgent care services know immediately that there's a plan for that particular patient, and they know what care to deliver, where, when and how. The inspiration for Coordinate My Care was my own family. My sister-in-law was 32 and she was dying of malignant melanoma. She had 4 children, a 5-year-old, a 3-year-old and a pair of twins, newborn twins. And each time she called for help, somebody else came to the house, and the default was always to send her to hospital. And she was looked after by the district nurses, by the hospice, by the acute hospitals, by the community, by the GP, and no one had a shared plan. And so every time there was a problem, instead of just giving her the care she wanted that had been planned for her, she was taken to hospital. So when she died, a group of us got together south of the Thames in London, and we agreed to have a hard copy, paper copy of a care plan. And out of that developed a digital plan, and out of that developed Coordinate My Care.
You know that implementation of innovation in NHS is really difficult, and as you said, there are many challenges, and there are many times where you feel down because it's really difficult, and I remember that day when I was on call, and it was in the evening, and I was on labour ward, and this woman came, and she said, "Oh, I have a high blood pressure, but this pregnancy's been much better than last time because I'm using this Hampton, and it's really made my life much easier, and I don't have to come to hospital often, and I can stay with my children, and her husband travels a lot." And then I said, "Oh, so do you like it?" And she said, "Oh, that's the best thing." And then just made me feel the rewarding experience that I had. Just said, well, that made my day. And even the fact that it's really challenging, actually this patient experience and the fact that it makes difference to her life, it works all the efforts and just drives me to work harder.
One of the things that comes across a lot when I talk to other people in the NHS Innovation Accelerator programme or other people trying to get really innovative products into the market is that it can be extremely tough. It can be something that you really have to persevere at, and you come up against lots and lots of hurdles and things that feel like doors being shut in your face. And there is nothing like working with someone who's living with dementia, who's affected day in, day out by a diagnosis of dementia, to remind you that those are just blockers to be overcome. That sort of classic, there's no problem, only a challenge or whatever. And that, in a sense, is exactly how the people that I work with and know well who are living with dementia face their life post-diagnosis. It's overcoming challenges, and it really inspires me and my team just to keep at it and overcome those challenges.
So to reinforce what Laura said about the report, we know that patient groups as a collective voice is a really powerful force, and it's difficult to ignore. So when groups get together, like for example the East of England Citizen Senate, and they have a collective voice about promoting innovation, it is really hard for commissioners to ignore. So one thing that I can say that we've actually got the evidence, certainly with one of the innovations that the fellows have produced, and that is the NIC and also Cardia. We played a key role, we meaning the Citizen Senate, we played a key role in promoting these innovations simply because we were able to see the value in what it would do for us. And the important thing to note here is that when we embark on this type of peer support, patients tend to trust us and have greater confidence because it's not the establishment that's talking, it's other patients who actually have that experience of the pathway.
Patients can have a strong voice, and particularly when they talk about their own experience. So we had one of our patients who in fact came with us to the judging panel. So we applied for an innovation award, and when we were shortlisted, and she came with us to the judging panel, and she spoke about her own experience and how the app made difference. And in fact, she came to the award ceremony when we won. And so it was really nice for the patient to be with you throughout the journey from beginning to end, and then she will become the voice that promotes your innovation and talk about how the value, and this voice is much better than your voice because you'll be seen as biased because it's your innovation,
exactly.
while the patient is actually the person who's benefiting from it.
Yeah, and I think other patients also, because of that, they tend to trust them more and they tend to have more confidence in it. You're right.
And there's a really nice example from one of our fellows, Peter, who's developed the NUX prevention system, which is an incubated tube for use during intensive care to stop all that gunk which would normally fall on your lungs. It's an automatic pressured cuffed valve that stops that happening and alerts staff when that cuff needs changing. There are a huge number of challenges to implementing a solution like that in the NHS, and Peter, quite rightly so, was finding it challenging. But then he went to present at his local citizen senate, and I think Trevor, you were on that senate.
Yeah, and I remember this really well because Peter had been struggling to try and get trusts and providers interested. So when Peter came and presented these two devices, the NUX and the NIC to us, we looked at each other in amazement and we all scratched our heads because the Citizen Senate is a group of about 30 people, all living with long-term conditions, and many of us had experienced some of the problems that NUX and NIC was going to prevent. So we worked with Peter to promote these devices at various commissioner fairs, mainly the CCGs and also the trusts, but we also did it via the STPs because the STPs were just starting then. This is around about 2 years ago. And we made a case, and patients are really good at this, and this is something that we should do more often. If we make a case, a good business case, and we show the benefits for patients, it's very hard for a commissioner to turn down. Because naturally, and you've been a commissioner before, what you don't want to hear me say is look at the cost of lost opportunity because of you. So they tend to take it on and they tend to prioritise it. And that's what we did with Peter's devices. We promoted it at all of the CCGs, most of the CCGs. We promoted it at STPs where they were making hospital reconfiguration changes. And we told all the patient groups about it. And I wouldn't say it's because of us, but I think Peter did his own hard work of promoting it. But I think collectively it made a difference.
So in Leeds, we've had amazing success with Freed spreading from our initial partner site set in central Leeds to 2 other eating disorder services across Yorkshire. And this has been completely a joint effort between the professionals who were originally involved with Freed, the wider service and trust, but also the young people who benefited from Freed within the Leeds centre that started. One patient in particular, Anna, has been really courageous in sharing her story with the NIA. She's done newspaper interviews, she's contributed a story to our website, and really spoken about how Freed made an enormous difference to her care, facilitated her recovery. She's now doing really well and has overcome anorexia nervosa. And it was having that personal story, that first-hand account of the difference Freed makes, that I think really has added to the success of Freed in the Yorkshire region and has allowed it now to be implemented across the county.
I think there's a lot of potential, there's a lot of enthusiasm from patients out in the communities, perhaps who just don't know some of the structures that they can be involved in that would enable them to influence change in local systems. Really, for me, I think that there might be scope for more local marketing to patients to make them aware that these kind of forums exist, so that they can become more empowered to get involved on those local boards. You know, just having patient representatives on the CCG boards have been incredibly influential. Trust boards have patient representatives in hospitals, for example.
Social networks.
Social networks, absolutely. So for me, I think they are very influential. I don't ever think you can go far enough in this space, though. I think more of a visible presence would attract more proactive patients into those.
But you know, there's still an issue here. I absolutely agree with you. Things are moving in the right direction, but it's meaningful engagement that is quite rare. So the CCGs around the country, and including Health Watch and the Health and Wellbeing Boards and all of the ALBs, the arm's length bodies, they engage patients, but they're actually not too worried whether they're meaningful or not. They could be an element of tokenism. I would say in the last 5 years that is changing, and your observation is absolutely right. I think now patients are more switched on. They realise what an opportunity this is for them, and engagement is much more meaningful. For your app, I can imagine they would have been really excited about that. And what actually patients actually want, the only way you're going to find out is by involving them in a partnership in the service that you're designing.
And Trevor, you talked about engagement, but not real engagement, not actually listening. And I think the examples that we've seen on the NIA, where there is true, meaningful engagement, where things are delivered absolutely in partnership, we've definitely seen a better designed product.
But I think one of the things that we've got to get better at, we meaning the providers, is making a sensible selection of which patients are appropriate for that program, because patients are just patients. They want to do their best to make a contribution, and sometimes they feel intimidated because they're put in the wrong place. And it's really important that providers think about this and give them the training if they need it, give them the support, because they only have to make that one comment that nobody's thought of. That makes it all worthwhile.
Just to agree with what Trevor said there, I certainly think that we all know that the NHS is going through a digital revolution as it stands at the moment, and really discussions like this are really positive discussions, and I just encourage entrepreneurs that are thinking about moving into a digital space, particularly within health, to engage in group discussions, involve patients right at the start, and you won't regret it.
I think what I'd like to say is that this is really exciting times. It's exciting for patients because there's so much innovation and there's so much potential out there. But also it's exciting because the NIA have given us a platform to try and promote and bring in some of these innovations. So from a patient perspective, I'm really excited about what happens next.